Welcome to Plaid for Women TV, your go-to resource for the business of life. Whether the CEO of your home or your own business, women struggle with the same challenges. At Plaid TV, we discuss real-life issues affecting real women and offer solutions to help you achieve your goals, get connected, and be heard. Together, we will change the world. Let's do this. No mean girls allowed.
Hey, welcome everybody to Plaid for Women Television. I'm Siobhan Palmer. This series, we're talking about women and health, specifically mental health. In this segment, I'm delighted to welcome back Dr. Nekesha Oliphant. She's the Associate Professor of Psychiatry and Behavioral Health at the University of North Texas Health Science Center in Fort Worth. Dr. Oliphant, welcome back.
Thank you.
In our first segment, we started to define three categories of mental illness: major depression, bipolar disorder, and schizophrenia. In this segment, what I'd like to talk to you is, let's get into some of the causes, known causes of these serious mental illnesses. Let's start with the genetic component.
So there have been multiple research studies to show the genetics that are involved with mental illness. There were twin studies, there have been cohort studies, and basically what's done, twin studies. Twins are raised by different families, and they're followed along if their parents had a diagnosis of mental illness, any of the above that we've mentioned, to see if the symptoms still present themselves, to decide between environment versus is there a genetic component. And there does seem to be a genetic component in all three cases, most significantly bipolar disorder. Mm-hmm. If your first-degree relative had a diagnosis of bipolar, there's an increased risk of near 50% above general population.
It's very high, yeah.
It's a very high percentage, yes.
And explain about the twin study. So you're saying that you followed twins that one or both were diagnosed with a mental illness, and then you just followed it from there?
Well, these were studies that were done long ago.
Mm-hmm.
This was the parents, based on the parents, and perhaps the children were giving up for adoption. And the children were showing no signs or symptoms of mental illness.
Okay.
They were placed with different families, and the question was, would the children still present with mental health issues after being raised in a different environment?
I see. So this, okay, that makes sense. All right. Let's talk about the environmental versus the genetic causes. I mean, current day studies believe that most mental illnesses are based on a genetic disease or biological illness, just like any other illness.
Absolutely.
And that's why, you know, as a health professional, I know you're very committed to breaking stigma on mental illness. Let's talk about some of the misperceptions people have about mental illness.
Yes. One is, if a person is homeless, they must have a mental illness. There is something called a socioeconomic drift model, meaning at some point, this individual was functional. The age of onset for schizophrenia in men is 18 to 25, so around college age. A little later for women, 25 to 30, and a second phase that happens around in perimenopausal phase. So these often were individuals who were doing very well in school, possibly playing sports. They go away to college, and for some reason, that's when the first onset of symptoms can occur. Now, the downward drift theory is that once a person is into the system of mental health, there's, because of stigma and other reasons, symptoms, sometimes under treatment of the symptoms, there's a difficulty finding jobs. There's a difficulty in jobs that pay well. There's limitations on health care that they're able to receive. And over time, sometimes bridges are burned. Individuals may start to self-medicate with substances, or families are just unable to help the affected individual any further. And then homelessness may come into effect. So it's not that homelessness causes mental illness.
It's a side effect of the actual mental illness.
At times.
Another thing that's very disconcerting for families is if you have a teenager who's depressed, that's a very usual scenario. So how do you ascertain whether it's just typical teenage moodiness and depression versus an impending serious mental illness?
And that comes to how severe are the symptoms? How are they behaving as far as able to participate in school? Are they kind of checking out of life? There's normal teenage moodiness. I don't want to go to the mall with my parents. I don't want to sit with my parents at the movies. There's a different level when they no longer want to be around their friends, or constantly getting kicked out of class, or
sleeping all hours
of the day, or starting to harm themselves by cutting or burning or other behaviors that they're trying to sometimes release the pain that's internal. So the severity of the symptoms and the dysregulation of behavior is generally the dividing line between what's normal teenage behavior versus a true diagnostic presentation.
Right. Are there any other factors from a cultural standpoint, ethnic groups, are more ethnic groups prone to mental illness, vice others?
These studies are very difficult to say because it depends on how willing a certain culture or sex is willing to go for treatment. So there's no real dividing line when it comes to mental health, whether that's socioeconomic status, race, religion, culture. It can happen to anyone. It's not always genetic. Sometimes a person is the only one in their family who has symptoms. And this is a first break that came out of nowhere, and therefore the family is not quite sure what to do with it, or what is this, where did this come from? So there's not a sure line on who is more likely to be affected. It's more who is more willing to go or more likely to present for treatment.
Right. I'm amazed at even in 2015 now, you talk to some populations where they don't even acknowledge mental illness. There's some cultures that think it's a devil or some kind of a spiritual demon that's taken over their family members. So when you're dealing with something like that, the chances of getting effective treatment can be very low.
Absolutely. And oftentimes by the time treatment is sought, the individual has gone through multiple other treatments, holistic treatments, herbal treatments, ritual treatments, or basically have been abandoned by their family because they've been written off as this is a punishment of some sort.
Right.
But again, this varies by culture, it varies by intellect or education level.
It does not discriminate mental illness.
Not at all.
That's right. Well, I tell you what, I appreciate this, and in the next segment, what I'd really like to talk about, because a lot of families watching this want to know what are some effective treatments, some that have been used in the past, and what's on the horizon to give these families and individuals mental illness real hope.
Absolutely.
Thank you, Dr. Oliphant.
Thank you.
This is Siobhan Palmer. We're Plaid for Women Television, doing our Women and Health series, talking specifically about mental illness. We'll see you in segment 3, where we'll be talking about effective treatments and hope for these individuals. Thanks for watching.
Thanks for watching Plaid TV. See you next time.